Welcome back here on Girl Talk. We're at Beaufort Memorial Hospital. Dr. Alejandro Garcia Salas has joined us. Thank you. Board certified in internal medicine. I cannot tell you how excited I am to have you here to talk to us. To have a physician, an internal medicine physician captive, is wonderful. And the goals of a lot of these interviews are really to provide takeaways for people so that they know when to come and see you. What is prevalent these days as far as disease. So talk to us a little bit, if you will, about your background.
Well, you know, thank you for having me.
Yes, I'm excited.
Thank you for having me here, and I'm excited to be joining Beaufort Memorial. So I just, you know, switched my career. I guess you can say I'm leaving the military. Okay. I was a Navy physician. I spent 4 years here in Beaufort at the Naval Hospital, and now I've made the transition to a civilian physician.
And you're going to be a private practice?
Yes, correct. So I will be working at Beaufort Primary Care. I will be joining Dr. Kessel, Dr. Hux, Dr. Webb, as well as two wonderful nurse practitioners.
Oh, that's exciting.
Yes.
What I'd like to know a little bit is, what is an internal medicine doctor? What specifically do you do? Because I think there's a lot of misinformation.
Yes, so we see a lot of chronic disease. Essentially, we are the gatekeepers. So you come to see us and you may have a problem, whether it's, you know, you feel like there's something going on with your heart. So we'll evaluate you and we'll run some tests. If we feel like there's something a little bit more concerning, then we essentially send you to a cardiologist or to another subspecialist.
So what I hear you say is you are actually my primary care doc. You're someone that I would develop a relationship with over time. You may see me now at 21 and all the way through my lifespan. Absolutely,
absolutely. Because we would be the ones that essentially know all your history, know all the places that you've been referred to, and the different conditions that, you know, are being managed, so that only one person, you know, gets to manage it all, and you don't have different physicians trying to give you different medications, because sometimes I may treat you differently as opposed to, say, the cardiologist might give you something for blood pressure. As long as we're all in sync with each other, then we avoid a lot of the medical errors that sometimes.
And plus, I really want someone who knows who I am as well as what my condition is, you know, because everybody's so different. I would think it really makes sense.
Absolutely, absolutely. And that's the type of relationship that you do develop, you know, through the years.
Is internal medicine adult medicine? At what age can I come to an internist?
So usually we tend to see 18 years and above.
Okay.
So usually 17 and below are considered more pediatrics, but 18 and above is the population that we see.
All right, let's talk a little bit specifically if we can.
Sure.
I have been here at 63. I've been hearing a lot. I know August is National Immunization Month. And it's funny because when I think of that, I think of kids.
Right.
I do.
Absolutely.
But not so much. As we age, as we get older, what are some of the immunizations we need to be aware of?
Well, one of the ones that you should always be aware of is your yearly flu.
I knew you were going to say flu shot.
Absolutely, absolutely. So that's one that you always should get. So that's
I hear so many.
year.
I hear so much pro and con about it.
You know, everybody has their cons, but as we get older, if you do get the flu, then you could be really sick. So maybe during our younger years, your body's able to fight it, but as we get older, then it becomes a lot more of a challenge, and then you might end up in the ICU or really sick. And sometimes it can take some time to get over that.
One of the other immunizations that I'm really curious about is the shingles vaccine.
Absolutely. So at the age of 60, that is recommended.
Why?
Well,
why?
Well, because you could easily develop the shingles, which essentially is a very painful rash. It's very painful, and it can last anywhere from 1 week to 4 to 6 weeks, and sometimes even longer. So it's one of those viruses that the majority of us have, especially if you've ever had chickenpox. It kind of lives dormant inside you, and the vaccine essentially helps to make the symptoms not as severe, and the length of time makes it a little bit shorter as well.
What about a vaccination for pneumonia? I've always wondered about that as we get older.
Absolutely. So,
really?
Absolutely. Okay. Absolutely. So usually that's recommended when you are at the age of 65 and above.
Okay.
Okay, so there's two. There's the Pneumovax, and then there's Prevnar. Depending on which ones you've had in the past will depend on how you receive them. Usually you will receive the Prevnar before you receive the Pneumovax.
You know, because we live in the South, and you've been here for quite a while, you're a Georgia boy.
Yes.
You know, mosquitoes are something, I have a daughter who's getting ready to have a baby, and, you know, the Zika virus is,
Yes.
what kind, and now I hear a bit about the West Nile virus. What is your recommendation for people and mosquitoes?
Well, you know, the West Nile virus has been in the U.S. for quite some time now, and as you know, the virus usually infects birds. So you have to have a mosquito that has been an infected bird and then has to bite either a human or an animal.
The perfect storm scenario.
Correct. So it's not very common, especially in this area. Although around this time of year is when you start to see a lot more mosquitoes. One of the things you need to kind of be on the lookout for is there standing still water around your house?
Okay.
So for example, if you have buckets of water, make sure you get rid of those, because that's one of the places where mosquitoes tend to lay eggs.
Exactly, dog bowls change them out.
Absolutely,
You know,
absolutely.
it's funny,
Your pet
that's something
dishes
that
as
I
well.
saw the other day,
Yes.
which is amazing. Well, it's really a pleasure to have you here.
Thank you. Thank you for having me.
Excited for you in your new
Yes, thank
adventure.
you.
You're working with wonderful people. We'd love to have you back on. There's a lot we can talk about, especially with this demographic.
Sure,
So
definitely.
we want to thank you. We want to
you very
thank all
much.
of you
Thank
for
you.
joining us here at Beaufort Memorial, here on Girl Talk. Thanks. Bye-bye. To make an appointment with Dr. Garcia Salas or any of the providers at Beaufort Memorial Primary Care, call 843-522-7600.